Hi, Leah. How are you?
Good, good. Hi, Andrea. How are you?
Yeah, I'm okay. Thank you. Nice to see you.
Well, nice to hear you. Can you?
Yeah.
I guess you can't hear me. You can't see me.
No, but you can try your video.
Here, yeah.
We have a few participants on already. Just to let you know, I wanted to make sure that I say your surname correctly.
Mm-hmm.
Is it
Yutasheva?
Yutasheva? Okay.
Yeah.
Thank you.
Okay, so it says that I cannot start my video.
Tatum will have to enable that for you. So in the meantime, welcome to those who are on. If you can go ahead and introduce yourselves in the chat. I think I'll just turn off my video for now. Tatum, could you check into Leah's video, please?
Sorry, Leah, I checked on my side. You should have the permission to do so. I'm not sure if it's your connection to Zoom.
It says, Tatum, it says you can't start your video because the host has stopped it.
Oh, okay, okay, sorry. I think now it should work.
Now it says your co-host now.
Okay.
Yep, we can see you. Thanks.
Okay, great.
Welcome. If you're just joining us, we are going to start at the top of the hour. In the meantime, please find your way into the chat room. The chat function is at the bottom of your screen in the middle. And if you could please introduce yourself with your name, organization, and country. Thank you. Hi, I see some of you are joining us now, so please find your way into the chat room. The chat function is in the middle at the bottom of your screen. If you could please introduce yourself with your name, country, and organization, and we'll be starting at the top of the hour. Could someone confirm that the chat function is working? I'm not seeing anyone introducing themselves. Ahmed and Debbie, you have your hands up. I'm assuming that means you're finding the chat, or you're not finding the chat. Tatum is checking it at the moment. I see several hands up. I'm not sure if I don't think you can unmute yourselves. Debbie, I'll unmute you. Go ahead, Debbie.
No, Prophet's disabled.
Thank you very much for letting us know, Debbie and Ahmed, and Tatum will enable it. Thank you. Tatum, can you confirm that you are enabling the chat?
Yes, we are trying to enable it on our side.
Okay, thank you. In the meantime, we'll get started. So welcome to many of you who are joining today's discussion. Apologies for the problems with the chat function. As soon as it's working, do please introduce yourselves with your name, organization, and country. So today's session is going to be on why blame the victim, pesticides and suicides. And I think this is a very important topic, given that suicides often are left out, for example, in the Rotterdam Convention, in other statistics that we have put together. So before I introduce our speaker, I'd just like to remind you of a few housekeeping things. So again, this is, as for some of you who have joined us before, I am Andrea Rother. I'm professor and head of the Environmental Health Division at the University of Cape Town. Tatum is providing technical support. You can go to the WhatsApp group, which is on the screen if you're having technical problems, and she will assist you. And hopefully the chat will be sorted out shortly. So the purpose of this pesticide discussion forum really is to bring together people from different regions, different sectors, different stakeholder groups to foster a mutually supporting discussion of stakeholders on various topics related to pesticides. And as I said, today we'll be talking about pesticides and suicides. Really, the pesticide discussion forum is looking to build the capacity of regulators, researchers, and NGOs in low and middle income countries, and to discuss emerging issues related to pesticide use. So we hope to achieve this by learning from each other, sharing information, data, perhaps identifying gaps, and even problem solving together with the common goal of preventing pesticide poisonings, chronic effects, and environmental contamination with a view to a toxic-free future for the next generation. So this forum is funded through Sweden, through the Swedish chemical agencies. It's not a webinar, but rather a chat discussion. We are not partisan, so we don't take sides, but we respect each other's viewpoints and we value all input that is given. Again, when you can introduce yourselves, please put your country and your organization and your name. And when you do respond in the chat to a comment or ask a question, it helps if you put your country as well. And we encourage you to engage with each other as well as the presenter. I see you now are introducing yourselves, so welcome to all of you. So it gives me great pleasure to introduce today's presenter, which is Leah Yutasheva, who is a policy director at the Center for Pesticide Suicide Prevention at the University of Edinburgh in Scotland. Leah has a background in law and human rights and has extensive experience as a researcher, as well as a policy and law reform specialist. She's worked on law and policy reforms in various regions of the world, including reforms on gender equality, migration, health, and protection from discrimination of vulnerable communities. She has participated in drafting human rights, gender equality, and anti-discrimination legislation in various countries. Leah has experience in assessing legislative gaps and working with decision makers, including the legal community and civil society. And her interests include human rights-based approach to pesticide management, prevention of pesticide suicide, policy initiatives to improve suicide reporting, and decriminalization of suicide attempts. Leah, thank you so much for taking the time to take us through this important discussion, and I hand the mic over to you. Thank you.
Thank you very much, Andrea, for the introduction. And I'm very happy to be here to talk about this important issue, specifically 2 days before the World Suicide Prevention Day, that is on the 10th of September every day. So I think it's an excellent opportunity to raise these important issues with this group, and I'm looking forward to the discussion. So if we could start with the presentation, please. Thank you. So first, I would like to introduce the initiative that I'm working for. It's a Center for Pesticide Suicide Prevention at the University of Edinburgh. The center was established in 2017, but it stems from a long period of work of our director, Professor Michael Edelston, and his group of colleagues on treating pesticide suicides in Asia and other regions of the world. And what they found out after this long period of work in treating patients who survived suicide attempt is that of course it's a noble and very important work to do, but it's much more effective to prevent suicide. One could save many more lives if suicide attempt is prevented rather than when it's treated after it's already happened. So our initiative was established to specifically focus on pesticide suicide prevention, and we approach it from the beginning, from collecting data, what is happening with pesticide suicide in the world. So first we collect data on first where this problem exists, about the countries, communities where this problem exists, and then we try to find out what pesticides are responsible for most deaths from suicide, as well as acute poisonings. And after that, we work with decision makers, policy makers, legislators, pesticide regulators in the affected countries to figure out an approach of how these highly hazardous pesticides could be phased out, taken out of immediate availability in the communities where pesticide suicide is a problem. And then, of course, we're measuring impact, and we work on finding out alternative approaches to pest control, and we engage in international collaboration. Next slide, please. So now I would like to give an overview of the situation. So out of 700 global suicide every year, at least 1/3 of those suicides are due to pesticide self-poisoning. That means that an estimated 110 to 150,000 deaths every year happen due to pesticide poisoning. And we do think that this is also a significant underestimation, because due to various factors, pesticide suicide are not reported. There's stigma related to this. So we think that those numbers could be a significant underestimation. However, we think research shows that at least 14 million deaths have happened since highly hazardous pesticides became widely available in communities in 1960s during the Green Revolution. Next slide, please. Unfortunately, what we see is this is a problem of low and middle income countries mostly. Why is this? Of course, highly hazardous pesticides are widely available in agricultural communities rather than in the high-income countries where agriculture is mechanized and there's no smallholder farming. So this partially leads to the fact that 77% of all global suicides occur in the low and middle income countries. And this is a very tragic fact. The reason corresponding to the availability of pesticide, the reason of this high number of deaths is that case fatality of pesticides when people use pesticides for poisoning is much higher than case fatality of other means that are used for poisoning in high-income countries. For example, where people use prescription medicine for poisoning. So as many as 70% of people ingesting aluminum phosphide die after ingesting it, compared to less than 0.5% of people ingesting prescription medicine in the high-income countries. And the same relates to paraquat. About 60% or more of people who ingest even a mouthful of paraquat will die, as opposed to that 0.5% or 1% of people ingesting prescription medicine. That means that fatality of poisoning is much higher in low middle income countries, agricultural communities, rather than in other regions of the world where pesticides are not so widely available. So that leads to the fact that in some regions of Asia, as much as 40%, or some time ago it was even 50% of all suicides are due to pesticide self-poisoning. Next slide, please. On this graph, you can see how the suicide increased in the northern India after aluminum phosphide became widely available in the communities there. So you can see in the 70s and early 80s, suicide rate was fairly low. And then when aluminum phosphate became widely available, suicide rate has increased dramatically, and you can see aluminum phosphide, deaths from aluminum phosphide have increased dramatically, and you can see how suicide rate increased together with it. So here is a clear example of how these two things are related. Next slide, please. A very important characteristic of pesticide suicide is that they are impulsive. People report that they start thinking about ingesting pesticides for less than 30 minutes before actually the act of doing it. So that means that there is no long and planned desire to die here. It is rather an impulsive act that occurs in the spur of a moment due to some socioeconomic stresses, marriage, family problems, and so on, rather than a long time to die. And according to this is the fact that there is rare association with mental health. So people, our research does not show that many people who attempt suicide with pesticide do have mental health problems. It is more of a cry for help for many people in a society where there may be no other recourse. Mental health support may not be available, or any other social support may be scarce. And another thing to note is that there is a rare means substitution. So people who attempt ingesting pesticide to kill themselves, they rarely go and try to kill themselves with different method. More often, they just, if they survive their attempt, they just continue their productive lives rather than try to kill themselves with a different method. So that means that those suicides are easy to prevent if means of suicide are not available. So it's, in a way, it's a low-hanging fruit of suicide prevention because mean substitution in this case works, and if a highly hazardous pesticide as means of suicide is not available, these acts do not happen. Next slide, please. So what is happening with pesticide suicide in Africa? I understand that many participants here in this discussion are from the African continent, so I think it's important to touch base on this subject. Our understanding is that the data are very limited on pesticide suicide in Africa. What we know is that suicide claims at least between 34 and 61,000 lives in Africa per year. And this is quite old estimates. But unfortunately, Africa is one of the few regions in the world that is experiencing an increase in suicide rate. Between 2000 and 2012, the African region saw an estimated 38% increase in suicide. This is significant, especially compared to the picture in many other regions where suicide is actually decreasing. And several countries in Africa are among those with globally high suicide rates. So what we think is between 15 and 33% of suicides are due to pesticide self-poisoning. That's according to 2007 data. But as I said before, this may be a significant underestimation because due to various reasons, suicide may not be reported, as well as pesticide poisoning may not be reported. So what we know for sure is that more research and improvement in data recording is urgently needed across the continent to understand better the extent of the problem. And of course, it's the same situation in many other countries and regions of the world. Next slide, please. Next slide.
Tatum, are you able to give us the next slide? We seem to be having a technical problem. Sorry about that, Leah.
No problem.
Tatum, could you just indicate that you are working on the technical issue?
So meanwhile, I think I'll continue. So what our research shows and WHO recommends as a means of suicide prevention is means control. And means control could be in various forms, of course, for every way of suicide, every means of suicide. So for example, after barrier installation in Hong Kong, suicide from jumping from heights was reduced dramatically in that country, in Hong Kong, or in any country where jumping from heights was a means of suicide. Detoxification of domestic gas in the United Kingdom led to a significant decrease in suicide by poisoning. And I think it led to 30 to 40% decrease in overall suicides. And the same happened around the world where in many countries where suicide by jumping on railway platform was the cause. After the installation of barriers on subway trains and railway tracks. So means control works, and it does work in the situation of pesticide suicides. So with pesticide suicide, means control means removal of those highly hazardous pesticides from immediate availability, means that means banning of highly hazardous pesticides. So if we could change the slide, that would be great.
I'm not sure if they're still having technical issues. Tatum, are you able to speak and indicate if there's technical problems? I have asked the team to see if we can get another projection up. Again, my apologies for that.
Yeah, so means control works, and in our situation, it helps to reduce suicide dramatically when highly hazardous pesticides are banned. And a good part of that is that research again shows that a lot of that agricultural productivity does not suffer from these bans because alternatives are available to highly hazardous pesticides that are banned. So a very clear example of that is Sri Lanka, where in the 90s, 80s and 90s, the country faced one of the highest suicide rates in the world. And about 2/3 of these suicides were due to pesticide self-poisoning. I have a slide that shows very clearly what has happened in Sri Lanka.
Apologies, Tatum's electricity went out.
Oh.
And so she's trying to load the slides up again.
I'm sorry to hear that. Oh, I think here it comes back.
Yeah, thanks for your patience. Apologies again. Tatum, if you can just move on to the next slide, please, that would be great. And Leah, you can just let her know which slide to stop on.
Tatum, can we change slides? Still does not work. Oh, now maybe. Yes, means control. So this indicates different means control successes. And if we can go to a different slide, the next slide I think will be on Sri Lanka and was what happened. And yet next slide here. So in Sri Lanka, as I said, Sri Lanka faced one of the highest suicide rates in the world. But after the problem was recognized on the highest level, 36 HHPs, highly hazardous pesticides, were banned with the incredible result of suicide rate decreasing by more than 70%. And that particularly happened in rural villages and among children and youth. So the suicide rate in Sri Lanka decreased from 57 per 100,000 population, which is very high. As I said, one of the highest in the world, to 17, per 100,000. So that is very dramatic decrease. And that there are estimates, and of course there's a lot of literature written about the success of Sri Lanka, but that saved over 93,000 lives over 20 years. And the direct government cost to do that was low compared to other interventions to save lives. Next slide, please. So here on this slide, you can see very clearly what happened in Sri Lanka. The suicide rate was fairly low in the 60s, 70s, up to the 80s, where the suicide rate started climbing. And when this first highly hazardous pesticide, parathion, methylparathion, were banned, there was a substitution with other means. And so happened again when the second batch of pesticides were banned here in the 90s. You can see that there was a substitution with other means. However, after all class 1 and almost all class 2 highly hazardous pesticides were banned, you could see that the suicide rate started climbing down and decreased. So this I think very clearly indicates that pesticide bans as a means of highly hazardous pesticide bans as means of suicide prevention work. Next slide, please. So how this has been done in Sri Lanka? It, of course, as I said already, did not happen overnight. And there were several regulations and several policy initiatives that have taken place. And it happened over 20 years or more even. And of course, it's to some extent happens even now. But several acts were very important. Several initiatives were very important in this policy. So Sri Lanka has adopted a Control of Pesticide Act that ensured that only least hazardous pesticides were available. And that act was an umbrella policy document that allowed the ban of class 1 and class 2 HHPs. Then Sri Lanka adopted a national policy and action plan on prevention of suicide in '97. And of course, it talked specifically, it talked broadly about all suicide prevention, but it also singled out pesticide suicides and specific methods of its prevention. And it has very importantly ensured cooperation between all government ministries and stakeholders. And it has also, it was responsible for creation of a high-level technical group or working group on suicide prevention in Sri Lanka, which I think at some point was led by the president, and that ensured a high-level will and champion for this policy. And of course, there were individual decrees banning pesticides that were issued by the pesticide register. So it's not one policy; it's a number of different policies that contributed to taking out of this HHPs from wide circulation. Next slide, please. Actually, I thought I have one more slide. I wanted to finish by saying that Sri Lanka's policy have been celebrated as a good example of pesticide management. And in 2021, it has won a prestigious World Council award, kind of indicating that this is a policy to study and follow for the rest of the countries that want to reduce pesticide suicide and improve pesticide management in their countries. So that was a high-level recognition of kind of this case study. So if that's the end of my introduction, and now we could go to question 1. Is that okay, Andrea?
Yes, I think that would be great. So we can go to question 1. That's fine. I don't know if there were any further introductory comments that you needed to make, but I think you've given us a very good background on it. So the first question that you're asking the participants is, why do you think pesticide suicide is predominantly a problem in low and middle income countries? We will respond to this in the chat. Leah, you're more than welcome to.
Yeah, Andrea, actually, I do have introduction to this question. Apologies.
Okay.
Yes,
yeah.
if you can go back to slides. One more, yes. So our first question, Andrea just read to you, and I look forward to your comments and to your ideas about this. But I would like to give some background first to why to this question, and what I consider, to share with you what I consider important in considering and discussing this question. So as I mentioned before, suicide is predominantly low and middle income countries. And of course, it's unsurprising, because pesticides are widely available in rural communities. They could be sold in convenience stores next to other food items, and they could be stored in houses with other everyday items. And here you can see on this photograph, you can see a child playing with empty pesticide bottles. And I think that is also not but also we need to know and need to consider that low and middle income countries use more highly hazardous pesticides than high income countries. So many, as we know, many high income countries banned HHPs, such as European Union, of course. And for example, an example here is in India in 2015, 59% of all pesticide sales were of highly hazardous pesticides, and that in contrast with 11% in the United Kingdom. The other thing to consider here is that people in rural areas could be more affected due to poor access to healthcare, lack of information about the adverse impact of pesticides. Poisoning treatment may not be available, difficult to access, and under-resourced. Next slide, please. So this all leads to vulnerability of people in low and middle income countries. People also can have high exposure to pesticides, not necessarily poisoning, but they could face long-term exposure as a health problem. There's poverty, climate change, gender inequality, domestic violence, that all contribute to vulnerability of people in the low income countries. And support for vulnerable groups, people in crisis, minorities, women in domestic violence, abuse situations may not have support as well. And of course, mental health services may not be available. Next slide. So this has been recognized by the United Nations. In 2018, the United Nations adopted a Declaration on the Rights of Peasants. And it specifically recognizes that smallholder farmers and people living and working in rural areas are affected by climate change, poverty, and the changing dynamics in agriculture, input, and food markets that are all contribute to the fact that these people are amongst the most vulnerable groups of people in the world. And this also, this recognition underlines that special measures need to be taken to lessen the impact of pesticides on people in low and middle income countries. Next, please.
So that should take us back into
exactly,
question
yes.
one. Yeah.
Yeah.
So because we're running a bit short of time with the technical problems, I have asked people to already start responding to question one, and there are several posts. So Leah, you're more than welcome to keep your mic open and your video on, and you're welcome to respond and speak to the comments and questions. In the meantime, we have posted the first poll. Is suicide with pesticide ingestion a problem in your country? You can indicate it or say that you're not sure, and the link to Mentimeter is in the chat, and I'll see you in the chat room. Thanks. So Leah, are you able to see the chat? You're more than welcome to respond to that.
Yes, I can see many people, several people here mentioned that pesticides are cheaper and anyone could buy them. And economic situation and income is poor in Iran, with greater access to pesticides, particularly to HHPs, due to lack of regulation. Of course, yeah, and one other comment here also says that the laws are not enforced. Unfortunately, low-income countries have, my understanding is that many countries have good laws, but the problem is that they're not enforced. And that leads to the fact that pesticides, even restrictions, those restrictions on pesticide usage that countries write into their laws, they're not enforced. Illegal pesticides are brought across the border into the markets where they're banned. And this is, of course, is one of the problems, yes.
There's a question for you from Ernest. I'm not sure if you can see that. So he's asking, can you see, is there a difference in data or all death cases are considered a suicide? Talks about homicides versus
yeah, yes, I will read the question. So we have cases of pesticide homicide, but cases of suicide are not well known. Is there a difference in data, or all deaths are considered as suicide? No, I think suicide and homicide are very different instances. Suicide is when someone, of course, ingests pesticide as a self-harm. Homicide is when this is directed to another person. Sometimes my understanding is that suicide with homicide together is a problem in several countries, where a parent, for example, does this to their child. Homicides are reported separately, and of course homicide is a crime, whereas suicide should not be a crime, although a suicide attempt considered to be administrative offense or crime in some countries. Unfortunately, homicide and suicide in many countries reported together as instances of unnatural deaths, but later on, of course, they are separated in the counting, because those are two different events. Homicide, as I said, is a crime, and suicide is not in many countries. But if one relies on newspaper reporting, they're quite often reported as one instance, and that is, of course, a big problem, because it also criminalizes and kind of stigmatizes suicide in many people's minds.
So I don't know if you wanted to comment on the previous poll, but there was a small percentage of people who were indicating that pesticide suicides is not a problem in their country, and I was assuming that these are probably from high-income countries.
It will be interesting to know which countries do not consider it a problem. Perhaps people can indicate it in the poll.
In the chat.
In the chat, yes, in the chat.
Great, thanks. Then we'll move on to the next poll. So is there underreporting of pesticide suicide in your country, and what are the main reasons for underreporting? This is an open-ended question. You can put your country in as well. You can click on the Mentimeter link again. Thanks.
I can see that people are here confirming that the laws are not enforced adequately, and HHPs are easily available to the ordinary person, so they can easily get hold of it. Yes, exactly. This is what we think is one of the main problems with pesticide suicide, that HHPs are readily available, so people can engage in this very impulsive acts. Because suicide is much harder to prevent when their mental illness is involved, and where a long planning and long-standing desire to die is involved. But those impulsive suicide, when people actually report to ourselves themselves, if they survive the attempt, that they immediately regret it, and that they just did it at a spur of a moment because they had a quarrel with their loved ones, or a student received a bad mark. We have many reports like this. Parents, we interviewed parents when they said, we don't even know why this happened. Perhaps she got a bad mark, we don't know. Such instances of just impulsive suicide would be possible to prevent easily without access to means. So someone here remarks that persistent pesticide residues in water and soil may pose significant health risk when ingested. This is true. This is not exactly what we're talking here. We talk about acute poisoning and self-harm with pesticide. However, there is some data indicating that a long-term exposure to some pesticides could lead to depression, and that could lead in turn to suicide. So I would like to mention that, yes. Here read in the second poll, many people say that there's no data. Okay, so here a colleague from Madagascar says that Madagascar does not have underreporting of pesticide suicide, I assume. This is great. Some countries may have a comprehensive surveillance and good death reporting system, and in this case, this could not, may not exist. Here, a colleague says in South Africa that clinics cannot diagnose pesticide poisoning correctly, so it's underreported. This is a very valid point to make. Our research also shows that in the majority of cases, it's not correctly diagnosed. And I'm not a medical doctor, but this is my understanding that it is very important, even for the survival of person, for poisoning to be diagnosed correctly and treated correctly. So lack of knowledge of doctors and lack of antidotes is an important issue here. So just to summarize this, maybe I can see that many people mentioned that lack of data is one of the main problems for the underreporting of suicide. But I would, this is, to my knowledge, this is totally right. And of course, if we had comprehensive surveillance systems and doctors and toxicologists knew how to diagnose and how to find out pesticide poisoning, our data would be significantly improved. I would like to point out that stigma of suicide and suicide attempt also could significantly impact pesticide suicide reporting or suicide reporting in general. Our research in Nepal recently showed that many people in Nepal thought including professionals and police officers and doctors, that a suicide attempt was criminalized in Nepal. But that was in real situation not the case, although some countries do criminalize a suicide attempt, which impacts reporting, of course. In Nepal, this was not the case. However, almost every person that we interviewed out of 20 people thought that this is the case. So there was a persistent belief in Nepal that suicide attempt is criminalized. And we think that was because suicide attempt is reported together with other unnatural deaths to the police. It's not a crime, but it is reported with other crimes, with crimes. So this, unfortunately, of course, adds to the stigma and unwillingness to report suicide to the authorities. Should we move to question 2 now?
Yes, that would be great. If you want to give us some background, unless you want
Yes.
to catch your breath, that's fine. Thank you, Leah. Go ahead.
So the second question is, what strategies are valuable to address pesticide suicide in your country? And as a way of background, I would like to mention the WHO 2014 document, Suicide Prevention, a Global Imperative, which suggests 3 approaches to suicide prevention. One is individual or indicated, such as improvement in healthcare, treatment, community support. The other one is selective, specifically for special groups that may be at risk, such as gatekeeper training, control and purchase of pesticides, for example, in the case of pesticide suicide, storage of pesticides. And the other one is universal, such in our case would be means restriction and HHP bans, control on the availability of pesticides. So this is a brief introduction. I would like to hear your thoughts on what strategies would be valuable to address pesticide suicide in your country. And so actually, I did not see which countries previously thought that this is not a problem. Pesticide suicide is not a problem in their countries.
I'm not sure if they were posted in the chat. We can have a look. Yeah. In the meantime,
Okay.
I do invite people to go into the chat and respond to the second question. And Leah, you're welcome, if you'd like, to stay online and respond to what you see in the chat. So we would like to hear from you in the chat, what you think are some of the strategies, particularly in your country, for addressing pesticide suicides. And you can post those in the chat. Thanks. Is everyone familiar with the Gatekeeper program? I don't know, Leah, if you want to give a few words about that.
Yes, Gatekeeper program is training for people who are the first responders to people who could be in suicidal crisis. For example, police, I guess even doctors, maybe to some extent. For our situation of pesticide suicides, a gatekeeper program, one of the gatekeeper programs would be vendor education. In Sri Lanka, our team of colleagues first interviewed vendors to find out whether they are interested in identifying people who may be at risk of self-harm and suicide, and then whether they would be in a position to identify and prevent or not sell pesticide to these people. So this is control, to some extent, control of access of people to means of suicide. And very encouragingly, almost all of the vendors who were interviewed in Sri Lanka, and later on we repeated this study in Nepal, all the vendors indicated that they are interested in identifying people who are at risk of suicide, and they all totally swore to us that they would not sell pesticide to people that they think are at risk of suicide. And here we also found out that, of course, an association with alcohol is a problem for suicide, and many vendors prefer not to sell pesticides to people who they think are intoxicated or are in distress. Well, another, of course, as I said before, as I underlined, ease of access is the main, in our opinion, and our research findings is that removing highly hazardous pesticide from immediate access would be the key to reducing pesticide suicides. But there could be many other interventions, such as also on the policy level, such as financial and other incentives to not use pesticides, or incentives to use non-pesticide means of control in their produce for farmers, as well as community support strategies or mental health support strategies to address suicide.
So there was a question about, or a comment about the cost and who actually funds the cost of the gatekeeper program. And I wondered if you could speak about that. Thank you.
Usually it's the state, is the government who funds the gatekeeper program, because many of the gatekeepers are in government employ, such as the police. I think police is one of the main gatekeepers to suicide prevention. In case of vendors, that was our study, and the study was funded by a research organization. But once this proven effective, I think it is the Ministry of Agriculture or Extension Services, even Farmers Association, who can fund this this training, because this is my understanding is that this could be very cost effective. One needs to teach vendors to recognize signs of distress, of course, alcohol consumption perhaps, and teach them or advise them to not sell to people that they may be at risk of suicide. However, I think the study in Sri Lanka is still ongoing. So we will share, of course, the results when it is done, when it is finalized. So here people say, Masudi Sasan says that compulsory withdrawal of common pesticide used for suicide from the market by the pesticide companies, agents. Yes, so action by the companies and substitution of those most harmful to health and lives by the companies with the less harmful alternatives would be amazing. If there is happening in Nigeria, I would be very keen to learn more about it. So what pesticides are being withdrawn by the companies in Nigeria? So here, Dina Rakotosoria mentions that in addition to increase control at the storage and enforcement of the law. Yes, I would like to remark on the storage situation. Household storage and centralized storage of pesticides have been attempted as a means of control of access to pesticides in several countries. And a big trial that was that was carried out in Sri Lanka indicated that this intervention as means control for suicide was ineffective, unfortunately. So what we found out is that, first, actually, I will describe how this was organized. So people were provided boxes for storing pesticides securely in their homes. And the idea was that if people can log their pesticides for the night or immediately after they use them, they will not be able to access them in the moment of distress when the suicidal impulse, for example, happens. Unfortunately, this has not proven very successful. After 1 year of this intervention, only 50% of all households that were distributed this household locker boxes were not using them. And then there were also evidence that it's very easy to break that box with a metal bar. Well, people of course have keys to it. So as a means of restricting access, that did not really work. It is possible that that those interventions can work in some areas, but our research did not find any evidence that it does work, unfortunately. So Placide from Rwanda says that this issue is not common in Rwanda because of strong regulation. This is very good to hear. I'm happy to hear that. And I assume that regulation is enforced in Rwanda. That's great to hear.
Leah, would you like to comment on what you see in the poll before we move on to the next one?
Mm-hmm. So people are saying that what are the main barriers is lack of data, ease of access, lack of community awareness in rural areas. Yes, in Tanzania, availability of HHPs as cheap cost hinder the process of addressing pesticide suicide. Yes, these are all valid points, and there are many reasons why pesticide suicide is not addressed and at a policy level. Of course, one is lack of data, the other one is lack of economic means, lack of capacity to understand that this is how to address this. I suppose a lack of alternatives. Many people say that, well, we don't know how to identify the alternatives to those highly hazardous pesticides. Well, our initiative is working with PAN UK and PAN International to identify alternatives. And if you are considering banning pesticides, certain pesticides in your country, please, you could drop us an email and with a description of what is happening, and perhaps, well, also FAO also helps with identifying alternatives to pesticides, I believe. So this all can be done. This should not be a barrier, but lack of political will, of course, could be an important barrier to addressing this issue. Governments have so many different priorities on their plate. Unfortunately, this may not be one of them. And this is perhaps our job as people, our job as people working on pesticide suicide prevention, but many here work in pesticide management. And this is one of the main problems, in my opinion, that pesticide management faces is deaths. People lose their lives due to impulsive acts associated with highly hazardous pesticides. So I think anyone who works in pesticide management should be concerned with this issue. So the next poll is, how can barriers to addressing suicide with pesticide ingestion can be addressed? And I can see one suggesting global action on HHPs would help. I wholeheartedly agree with this. A global action is definitely lacking on HHPs. It has been discussed for so many years at SICOM and other forums on pesticide management, at pesticide management convention meetings. And still there's some blocks to moving forward. Yes, there's a comment, having policies that aim to protect human health from the use and handling of pesticides. I think what I try to show in this presentation that some people could be particularly vulnerable and to the effects of pesticides. And it is the government's and international community obligation and the company's obligation to address the situation because the human rights framework, and I will talk about it in the next question as well, but the human rights framework clearly states that governments need to protect the health and lives of its population. So Leonard, in the comment here, says, suicide is the fatal outcome of a cry for help. Many times people survive a suicide attempt by chemical, but with HHP it is less. Exactly, I totally agree with this. We have to address the underlying issue. Why do people commit suicide? Also, suicide can have a stigma around it, which may also explain underreporting, apart from lack of forensic examination of suspected suicide. Yes, a very good point. Addressing the underlying issue, why do people commit suicide? Yes, this is perhaps a job for mental health professionals, psychologists, and so on. For me, as a person with a legal background, the main question is not why do people commit suicide, but of course it is important. For me is whether this can be prevented, whether impulsive suicide can be prevented. And here, you know, we don't really care. Well, of course, we do care as a comprehensive way of addressing the problem of suicide. But for many impulsive suicides, well, if it's a quarrel with the loved ones, or if it's bad marks at school, or is it a quarrel with a mom or a brother or something like this, it's not really important. If it's impulsive and people regret about doing it immediately after doing it, maybe it's not so important. Maybe what is important is to remove the means of highly hazardous, toxic means that can kill immediately. So people do not even have time to consider what they're doing. On our website at centerpsp.org, you can see many videos that our wonderful filmmaker has made portraying the impulsivity of this act. Please, if you have time, please go and see those videos. They're easy to find on our website. For many people, it's just impulsive. It's not a long-standing problem that they consider and think and plan. And those are the suicides that are easier to prevent. People who plan it is in a different category, but the category of people we're dealing here with impulsive suicide, it is easier to prevent than the other ones.
Leah, would you like to make any concluding and summarizing comments before we move on to the third question?
No, I think it's fine. Let's just move to another question. Many people have commented, and I think I commented on some of those comments. So the third question is, how can pesticide regulation be used? And as a way of background, I wanted to I just mentioned that, of course, restriction of HHPs could be done through legislation and policy on national, regional, and global levels. And I believe that we all know about the international chemical conventions and many regional initiatives to phase out highly hazardous pesticides. But of course, national legislation is the main way of removal of highly hazardous pesticides from use and in preventing pesticide suicide. Can we have next slide, please? So national policies, as I mentioned when talking about Sri Lanka, can be adopted through laws by the parliament, but policies consist of many different documents and regulations. So regulations or decrees can be adopted by the Ministry of Agriculture or pesticide regulator. They could be a strategy by the Minister of Health or Minister of the Environment. And the policy could be a combination of all these acts and regulations altogether. Can we have the next slide, please? So here I would like to address one of the poll questions that comes later. Whose obligation is it to prevent? And I think I have mentioned before that that the vulnerability issue and the fact that actually governments, according to the human rights framework, governments do have an obligation to provide healthcare and health services to their population, and they do have an obligation to protect life. One good mention of this is in general comment number 36. And that is a document, a general comment as a document that the United Nations human rights organizations draft to explain to countries the extent of their obligations according to the human rights law. And in this case, Article 6 of the International Covenant on Civil and Political Rights. And this paragraph says that while acknowledging the central importance to human dignity of personal autonomy, states should take adequate measures without violating their other covenant obligations to prevent suicide, especially among individuals in particular vulnerable situations. So this is very clearly states that states do have an obligation to prevent suicide, especially for the individuals in vulnerable situations. And of course, many states do that, and that is manifested in suicide prevention strategies that states usually, many states adopt. Can we move to the next slide, please? According to the human rights framework, the duty to protect the right to life includes a positive obligation to adopt measures to protect life from all reasonably foreseeable threats. And not only government, but companies should also respect human rights. That means that they should avoid infringing on the human rights of others and should address adverse human rights impacts of their action. And that is stated in the guiding principles on business and human rights. So here are some beginning of beginning kind of snippets for you to think about. And I would like to hear more from you how regulators can be convinced to act on pesticide suicides. And one of the polls asks, who do you think is responsible for preventing those pesticide suicides? So this is the end of my introduction, and if we could move to the question, please.
Thank you. So we have posted your link as well in the chat, but now we move on to the third question.
Mm-hmm.
How can pesticide regulation be used to prevent pesticide suicides? And perhaps you can give an example of how that could happen in the chat. Thank you.
So I would like to comment to a Blessing Maluma message here. I think that was related to a previous question, that people opt out for different instruments to achieve means. This is true, but this is not necessarily true for impulsive suicides. So our research shows that less than 10% of people, when they survive their suicide attempt, less than 10% go on to select a different means of suicide. So for many, many people, especially with pesticide suicide, this is an impulsive act. And if they do survive, they do not attempt this again. Or if they continue, if instead of the highly toxic means, they have a less toxic pesticide, they may still, of course, resort to an impulsive suicide, impulsive self-harm, but they will not die. They would survive if they, instead of paraquat, ingest a less toxic, much less toxic pesticide. They would survive and continue living their productive lives instead of trying again. So, and basically, yeah, if they don't have that lethal means, they would not die to start with. So that's, I think that is an important point to consider. Yes. Debbie mentions that by not registering 1A and YB pesticide, that would help. I totally agree. Not registering the most toxic pesticide would be the easiest way of preventing impulsive deaths from highly hazardous pesticides. Good point. Yeah, there's a good example from Iran. Thank you for that, Ahmad. Mm-hmm. Suresh from Guyana mentions that paraquat is one of the main pesticides used for suicide. The pesticide authority has instituted a restricted use of this pesticide, and this has reduced accessibility to unauthorized persons. This is very good news. Our research shows that restrictions may work, especially if the legislation is enforced. Of course, enforcement of legislation is paramount in this case. In our experience, for example, South Korea and Taiwan shows that many countries that restricted paraquat first, especially due to a high suicide rate, continue to find out that they actually can ban it at the end. So in South Korea and Taiwan and several other countries, after a period, even Sri Lanka, after a period of restricting paraquat, many countries opted to ban it and take it out of the market altogether. They found out that they can live without it. Yeah, several very important comments here that from Dina about restriction is necessary. Yes, regulations can eliminate the use and availability of HHPs. Safe alternatives can be promoted through regulations from Martin. Yes, I totally agree with this. Implementing the precautionary measures of elimination and substitution from the very beginning will minimize poisoning. So precautionary measures, precautionary principle in registering the pesticides to start with, I think is a very important principle that the European Union is promoting. And that could be used in any country, I think. So the poll about who, in your opinion, has the main responsibility to prevent self-poisoning. I'm very happy to see that the government is on top. Healthcare professionals, of course, to pesticide manufacturers. I believe this is correct. I think pesticide manufacturers has the responsibility to prevent poisoning suicide. Retailers, perhaps this is not their main responsibility, but they could play a role in this, the same as intergovernmental organizations, if they choose to engage in this matter. Of course, they do not have, I don't think they have a responsibility, but if they choose to work on this issue, they could, and they could be very helpful. Sorry, intergovernmental organizations, of course, do have responsibility. Civil society, if they choose to work on this issue, could have responsibility. Intergovernmental organizations, of course, do have a direct responsibility, especially FAO and WHO. People who attempt suicide. I'm not sure if I agree with that. I was hoping that this presentation showed that for people, it is, for many people, it is a cry for help. And helping them in the situation where people may have very little means to cope with this highly toxic means that have been placed in their direct proximity. Helping them, I think, is a government and society and manufacturers' responsibility. I think people in the situation of vulnerability could not be held responsible for misuse, the so-called misuse of pesticides, because this is what suicide is. Ingestion of pesticide is misuse. I think it would be wrong to blame the people, pesticide suicide victims, for this desperate acts that are done at the moment of vulnerability, at a moment of crisis.
So we have a last poll up. How can decision makers in your country or region be convinced to address the problem of pesticide suicides? And I think really it's, it's unpacking also, many of you keep saying awareness raising, but unpacking, how can it be done? So how can decision makers be enlightened about the issue and the problem, especially with HHPs being used for suicides? Thank you.
Yes, the illegal trade of pesticide is a big issue that will require cooperation, coordination from many government institutions, customs, and border guards and border patrol services. This is a whole other issue too, to implement and enforce. So many people here say data is important. Regulations need to be implemented. by engaging researchers on pesticide suicide, researchers, and I think cooperation between researchers and policymakers, government institutions is very important. But I think also understanding from the Ministry of Agriculture side, as well as the Ministry of Health side, that their cooperation on this issue is of paramount importance. It's not only Ministry of Health that is responsible for suicide prevention. In case of pesticide suicide, it is also the Ministry of Agriculture, pesticide management authorities, perhaps in the countries where it's the Ministry of Environment. These stakeholders need to take part in addressing this issue. And I would totally agree, data is of paramount importance. High level cooperation, high level willingness to do something, awareness that this is a problem in the country is extremely important. Yeah, so, and I think it will be interesting for all of us in the future to know, there are several mentioned here of Guyana, that in Guyana policymakers are convinced because suicide is a major problem and that paraquat is being restricted now. It will be very important for all of us to keep tracing, keep in touch with what is happening in Guyana and see hopefully the success of paraquat restriction and decline in pesticide suicides. That would be amazing to see as a result of all the work that is being done in Guyana and in other countries, if this is the case. Yeah. Of course, sensitization of all involved actors is important, as Dina says here. It is very important to include pesticides in the government policies at national level. Exactly. I very much agree with that, that it is, of course, policies are only as important as to the extent of the implementation, but still policy pronounces the will of the government, and then by that it gives civil society advocates, researchers, a way to keep government to account. The same with legislation. Legislation is, of course, is only on paper until it's but it gives civil society actors and advocates a good tool to call the government to account and to make them responsible for their promises. So legislation and policy is one of the first steps in a long way towards success. Yes, establishment of poisoning management centers, of poison information centers. I think it is very important, and in the case for the countries where it is being considered, I think it's important that they do take they do monitor a situation of pesticide suicide. Sometimes it is called misuse of pesticides, and is not even this information is not taken into account. It is very important, and it's important what ways of surveillance to understand for every country that wants to understand the situation. I think it's important to know what sources of information can be used. Our research shows that in many countries, it is the police who collects the most reliable data. Of course, hospitals and Ministry of Health could have data, but in many low-income countries, this unfortunately is not the case. Then one needs to understand how this information pathway through health authorities can be improved. It is also toxicology labs that may hold reliable data on pesticide poisonings. Toxicology labs usually receive cases of death by poisoning, and then they analyze what pesticide or chemical could have caused death. So toxicology labs hold important data for pesticide suicide prevention. So those are important sources of data, and decriminalization of suicide attempt in the countries where it is criminalized, I think it's also very important, because this serves as a major hindrance to reporting of suicide. Or even in countries where there's a perception that there could be some negative consequences associated with reporting suicide or reporting attempted suicide. I think in many countries which were part of the British Empire earlier, suicide attempt has been criminalized following criminalization of suicide attempt in the United Kingdom, more precisely in England and Wales, because in Scotland it was never criminalized. England and Wales decriminalized suicide attempt in 1961. Nevertheless, several countries that were part of the Commonwealth still have criminalization of suicide on their books. And even when it's not necessarily implemented, some countries do implement it, I know, but in many countries it is not implemented, so no police investigation or negative consequences really exist. Still, people are afraid to report suicide or suicide attempt, and this serves as a major barrier to suicide reporting.
So Leah, you've taken us through a very important topic that we probably don't talk enough about, and I'm hoping that you have stimulated a lot of thoughts and thinking by all the members here today, that perhaps within their different sectors and the different organizations that they represent, that they will raise some of the issues that you've raised and also come up with some strategies for addressing it. And perhaps if they're not already involved in highly hazardous pesticide regulation or drawing attention to it, perhaps they will take more of a role of that. So before we conclude, are there any final statements that you would like to make?
Well, I would like to thank everyone for this very interesting and productive discussion. And I think lots of very good points and suggestions have been made. I'm hoping that now, in 2 days, there will be a World Suicide Prevention Day. And I'm hoping that people who participated in this discussion will take a moment to think how, in their position, if they think suicide, pesticide suicide is a problem in their country, I'm hoping that they will take a moment to think how they, in their position, can do anything to influence decision makers, influence the situation that is in their country, how the situation can be addressed if this is a problem. And just think about all those people who whose life may be saved if there are less availability of highly hazardous pesticides that are available for impulsive action. Thank you.
Thank you. Thanks very much, Leah. And thank you again for your time, both in preparing and taking us so carefully through each of the questions and really stimulating quite a vibrant discussion. and also encouraging people to continue further. There will be a digest, so there will be a summary of the discussion. Please make sure that you have signed up as a member of the Pesticide Discussion Forum. The link has been posted in the chat. There's also a poll that's up, and you can click on the link in the poll if you'd like to sign up. Also, to draw to your attention that we do a newsletter where we have an editorial about various issues, and we have the latest research, training, and capacity building information. So please make sure you've also signed up for the newsletter. I'd also like to thank Tatum in the background, who was managing despite power cuts in South Africa. Just to draw your attention to our next discussion, which will be on the 22nd of September. No, is that correct? How to restrict access while protecting agriculture? I believe it is. So we are doing suicide again, my apologies. I read it too fast. So we will have another guest speaker from the Center for Pesticide Suicide Prevention. So thank you to all of you. We'll leave it open for a few more moments if you want to post some more on the poll. And I wish you all the best of the rest of your day and stay safe. Thanks, everyone. Bye for now.
Thank you, everyone. Bye-bye. Thank you.